All right. Good morning, everyone. Welcome to the October Brooklyn Developmental Disabilities Council monthly meeting. I hope everyone is doing well. We have a full agenda today, so we'll jump right into it. We will leave time for announcements at the end, so any agencies, any legislators, anyone else that wants to make any type of announcement, obviously you can always put it in the chat. We record the meeting, we save the chats, we post it on our website after the meeting. So please feel free to put it in there, and we will leave time at the end for anyone to make any type of other announcements. So we will get started with a couple of Brooklyn Council updates. We are working behind the scenes to get more committees up and running. Rochelle and I and some of the other team members have been busy meeting with people interested in taking over some councils. So we're hoping sooner than later we will have an employment committee up and running, as well as our legislative committee. And we do have a number of other committees that have already began. Transition committee has been meeting monthly, children's services, and the family provider and care management information committee. I think that's all of them. Did I leave any out, Rochelle? Yeah, I think that was all of them. The other thing on behalf of the Brooklyn Council, what we're asking is for agencies on this call. I know that IAC and some of the other provider associations are working on gathering data in regards to constituents in your programs and locations of agencies and local legislators. We're asking that please start looking at that from your agencies and maybe make small day trips with your groups to bring people out. And I know we send a lot of emails and we do a lot electronically, but it's very different and it sends a different message when we show up at legislators' doors with the people we support who are constituents in their areas and to talk about the programs that we run in their areas. And we need to get back to doing some of that stuff post-COVID. I know some agencies are, but the more we can get agencies on board and people going out with their staff in the community and talking about the impact of not having DSP increases and cuts to our field and all the asset we're looking for to support this population, along with the continued emails and trips to Albany and Washington and all that, we think it'll be really impactful and beneficial. So we can definitely talk more. If you're interested in finding out what to talk about, who you should be contacting, please reach out to myself, Rochelle, anyone from the Brooklyn Council, any members of IAC, and we can definitely get you more information to talk about with your local legislators. Any other announcements you want to make, Rochelle, from the council? No? Okay. Don't want to put you on the spot, just asking. All right, so I want to keep it brief. We do have a big agenda today. I know Chris and Debbie have to jump off, so we're going to give them a few minutes just to give their updates now. So if you guys can just make your brief updates, and then we will get into our normal agenda.
Let Debbie go first and I'll go behind.
Okay. Wait, Debbie, we can't hear you. No,
Nope.
See you talking, but can't hear you.
Can you hear?
Yes, we can hear you now.
Okay, sorry for the piano in the background. Okay, first I want to thank you, Brian, for helping us. Also, is Rosal on the meeting today? For the provider also information. In case she's not there, I'm also gonna do her report partially quick, okay?
Okay.
All right, first let me do the advisory. The advisory last met on October 17th. We did it via Ring Central. We discussed first about how well the resource fair that we did in partnership with the Brooklyn DD Council, as well as from the Brooklyn Public Library, thanks to Carrie, the inclusive services, which we did very well at the Kings Highway Library. We did get good attendance. Our next one will be on November 3rd. Now I have to tell you, agencies, we do not have any more tables available, no space. It's a very small space. If you can still bring information, and then Carrie will help put it out on tables and see that it's distributed through the libraries. Also, parents can please invite your parents to come This will be held at the Canarsie Library on Friday, November 3rd, from 11 to 1 p.m., a.m. to p.m. Also, we have been discussing about the ADM for the reimbursement. There's still a lot of talk. We know that there's a possible survey maybe coming, but I'm asking anybody who's had issues with their reimbursement about being turned down or having issues for stuff that you used to be able to get for your child, but now is on the not allowable list. Please let me know at the advisory council. You can email me at bfssac@yahoo.com and I will answer back, or because we're trying to find out how it's affecting the families, and we need to know how the agencies are being affected with this. At the Brooklyn Provider Information, we met was the second Wednesday with Rosal Post-Chair. We did talk about the ADM reimbursement. We talked about the issues they're having. They know they can email me, as well as the statewide family support coordinator is Nick Hobson, and we made sure to let everyone know that our local DDROs, whether they're Brooklyn or anywhere in the city or across the state, are not responsible for the changes in the ADM because this was done by Central. They were trying to make everything, whatever is allowed in New York City with the 5 boroughs, can be allowed up in Buffalo and the other region. So our next meeting will be Ring Central Zoom. I'm going to ask Chris to tell the date because
November 21st.
Tuesday, November 21st on Ring Central from 10 to 12 p.m. Thanks, Brian, and take care, everybody. Sorry I'm not
Thank you,
there.
Debbie.
You're welcome. Thank you.
All right, Chris, you want to make your brief announcement?
Yes, good morning, everyone. Brian, I know I sent you my report. Can you please make sure that's forwarded to all agencies? And this is for ISC as well and OPWDD. For the last 2 weeks, we received a lot of complaints from A, Accessoride, B, the MTA bus, and C, other area transportation on the MTA. Please remind everyone, calling 511 is one option. The second option is to go onto the My MTA website and go to the customer feedback. With there, you can put your complaints in. Now, some of us may not have email access or computer access, but you guys can help a fellow parent, fellow individual, or a fellow advocate. And the reason I'm saying the word advocate, that could be an individual or a parent or anyone. Please make sure you guys help that out, because once you put that complaint in, you get a reference number. And that reference number is good for at least 8 to 10 days. That's including if there's a holiday, so you know that goes to additional day. Please make sure you guys do that as well. And I'm going to remind you all, please, guys, when you do check the MTA website, please check on weekend geos when they do the track works. We have a major track work coming up in November that will suspend service between Manhattan and Queens. Please read all the signages and directions where they're doing. As I remind you, when the attachment I put in for Brian, it also has the 20-year assessment. That's telling us what we're going to be planning in the next 20 years. It may go through, it may not go through, but either way, it's just a plan to think about. So everything I send to Brian is there. As you see, I'm not actually where I am today because today Debbie and I are actually not at our normal spots. We're live somewhere. We have to do other things today. But just to remind everyone, please make sure any questions you have regarding the MTA or accessibility MTA, please email me at chrisgreif@yahoo.com. If it's Advisory Council business, it should be emailed to the bfssac@yahoo.com. So therefore, it goes quicker in understanding that. And thank you I'd like to thank everyone who did attend the resource fair. Brian, thank you for being there. We did have a good turnout. I know Deborah mentioned November 3rd. It is on our website. I know I sent it to Brian also. But anyone has any questions, I'm only going to be here for another 5 minutes. Then I have to head to my station where I have to be. Thank you, everyone. Brian, do you have any questions for me?
No, I don't, Chris. Thank you.
Any questions on the chat?
I don't see, let me just double check. I don't believe there's any questions for you on the chat. No,
Yeah.
thank you, Chris.
Okay. Thank you, Brian.
You're welcome. Thank you, guys. All right, so now we'll get back to our regular agenda order. So OPW updates. I believe I saw Lucy and Nina.
Yes, good morning. Do you hear me?
Yes, we do. Thank you, Nina.
I'm so happy that I was able to log in and actually see everyone on camera today. I hope everyone had a good weekend. We had a rain again on Saturday, right? It was like a 7th week of raining on the weekends. So we have some updates for today, and we'll start with a reminder that CNE's conference is taking place this week in Albany. The conference is will be at Albany Marriott Hotel on Wolf Road. And I mentioned last month that conference registration fees are reimbursable through person's self-direction budget for those who have self-directed budgets. Time is running so fast, and we're quickly approaching November. November is the month for election, and voting is our national, state, and in local elections is the civil right of every citizen, including people with disabilities. Voting requires planning. The deadline to register to vote is October 28, 2023. To register to vote, find early voting information, find absentee voting information and deadlines, or your county board of election. Please visit our New York State website at elections.newyork.gov. If someone needs help registering to vote or find additional information, OPWDD, we have at OPWDD, we have a National Voter Registration Act liaison. His name is Michael Orzel. I have his email address if anyone wants it, and his phone number. So if anyone is looking for help to register for November elections, we have someone in Albany who can assist. October is a month for National Disability Employment Awareness, and every October we celebrate the contributions of workers with disabilities and showcase supportive, inclusive employment practices that benefit employees and the workers. On October 3rd, Commissioner Neifeld attended Governor Hochul's second annual Disability Rights and Employment Awareness Month Symposium in Albany. At the opening ceremony, she made a special announcement about the launch of a new training that will soon be available to employees across the state who would like to create a more inclusive and diverse workforce. I think I mentioned last month that we have received a CMS approval for waiver amendment 14, which went into effect October 1st. This waiver amendment 14 will permanently adopt some of the provisions that were authorized under authority of Appendix K, which was to address COVID-19 public health emergency. This waiver amendment includes programmatic fiscal administrative changes that are intended to build on lessons that we learned during the pandemic and improve effectiveness of waiver services moving forward. OPWDD is working right now on finalizing guidance for a new home enabling support sub-service that will allow for people who live at home to continue to live at home with additional assistive technology services. And we are working on finalizing procedures that will be shared soon with the agencies and families. My next update is on RPA funding. The OPWDD is using a considerable amount of money for comprehensive evaluations for on several programs. We are evaluating self-direction program. We are working on the care coordination program evaluation and managed care. With self-direction, we heard a lot of feedback from the families and stakeholders that program needs improvements, and we need to have a better policies to streamline our practices and be more consistent across the state. We are still evaluating the proposals of what organization will be evaluating self-direction program, but hopefully once we find, or once we select the organization who will be evaluating this program, it will become more accessible to more people and ensure it supports the best outcome. We are partnering with American Institute of Research on evaluating the effectiveness of care coordination practices. And this American Institute of Research, they were chosen based on their experience of evaluating similar programs in for other state and federal entities and nonprofit organizations. The evaluation will include a review of current procedures, identification of opportunities to streamline processes, research on promising practices, and submission of recommendations on how to improve the quality of care managers and the care management model, which is very essential in everyday delivery of services. And the last one is the evaluation of managed care. OPWDD is partnering with Guidehouse, and we are assessing the quality and outcome of managed care for people with developmental disabilities. Guidehouse will be providing reports to New York State Legislature on the progress of this evaluation. And Guidehouse, with the assistance of OPWDD and through the engagement of the state with the stakeholders community, will evaluate the potential use of new service models, including managed care, to support the goals and objectives that were outlined in OPWDD strategic plan. And you probably know that recently OPWDD and Guidehouse has conducted several stakeholder forums, and they were soliciting feedbacks, and I believe there were surveys that went to the family stakeholders, providers, CCOs on to gather information so they can continue to evaluate the managed care models. And the last thing for today, I just want to mention that in September, OPWDD sent a new informational letter regarding lockable doors in privacy and lockable door and privacy in specific settings. The purpose of the letter was to provide some answers and clarity to some questions that were asked concerning the requirements for the use of locking mechanism in certified and other provider-owned controlled residential settings. This is for people who receive HCBS waiver services. And that's it for me for today. Thank you.
Thank you, Nina. I have a question for you regarding the CCO evaluations. Is there a time frame on that, just for agencies to know if it's going to be evaluated and changes are going to be put into place, that we should be looking out for changes, because that would impact the providers as well?
I can ask that questions, and I will send you the response.
Okay, thank you.
The timeline of that evaluation of the CCO program. Okay.
Does anyone else have any questions for Nina?
I wonder if Richard has the answer for the CCO evaluation program. If we have, how long it's going to take?
No answer.
Okay. Oh, no comment.
Brian, I have a question. I actually raised my hand. So thanks, Nina. It was very informative. I have two questions actually, but the first one is around the waiver that was just adopted. It's
Mhm.
am I correct that the one thing within the waiver proposal that wasn't approved was the retirement option for older adult participants in day programs?
Right. I think that we are further. I think not every proposal that went into the amendment was approved, right? And if I'm not mistaken, CMS asked OPWDD to further provide information on that senior program. I do not. I could. I'm almost certain that we need to provide additional information to CMS on that.
Okay, so it's not dead in the water, it just needs more clarification?
I think so.
Okay,
And that's what was reported at the Provider Association meeting by the commissioner. It was one thing that was turned down for, temporarily.
okay. You know, as a parent of a 40-year-old, I am thinking ahead and wondering what the options will be for my son in the future. So this is something that's important to families. And in terms of the managed care evaluation,
Yes.
okay, so how can people submit further comment? We're getting a lot of feedback particularly from family members who participated in these guidehouse events and they vary tremendously. I've heard the reports from, all the different sessions from different people, and one was completely unlike the other. And people often felt that they didn't have an opportunity to say what they wanted to say, or the questions didn't really work for them in terms of giving input about their concerns about managed care. So what do you know about as the most effective way? I hear there's a survey coming. I personally haven't received one yet, even though I participated in the session, and I don't know anybody else who has. So are there other ways for stakeholders to, give written input into
Yes.
this?
Yes, and I should have mentioned that the email, we have the email address. I'm going to put it in the chat box. It's AFBA.inquiry@opwddny.gov. And I will type it in a chat for everyone to share. So you can send your feedback, questions, or comments to this mailbox in central office.
Thanks so much, Nina.
Thank you.
Does anyone else have any other questions for Nina?
Sorry to interrupt. This is Chris. Nina, can you please email me that information? Because I am not in front of the computer. I'm on a cell phone.
Yes. Yes, Chris, I will.
Thank you. Thank you. And very funny earlier.
Okay, Nina, I don't see any other questions, so thank you so much for your report. Appreciate you being here, and I'm glad that technology worked this month.
Thank you.
All right, next up on the agenda is Richard from IAC with the IAC update.
Hi, everybody, and let me just start with technology. Before the meeting officially began, I just had to note that IAC has been having difficulty with its email because we have a new IT provider, and they've been limiting how many of our emails can go out. They temporarily stopped it. They're putting it back on today. It's like a filter that only allows so many emails because they're afraid that we'll end up on a spam list. And even though we've been doing this for as long as we've had email systems, and when someone does spam out IAC, we get in contact with that executive or someone else there, and they put us on the good list. But they're going to go ahead with this. I think I've been hearing that from other DD councils. It's why the attendance has not been as high as you would expect. And how do you find out if someone didn't get your email unless you bump into them in the hallway or into a restaurant and they say, I didn't get that email, right? Brian, you had an instance of that, but So just be aware there's technology updates going on all throughout our life. And fortunately, the AI listener, artificial intelligence, the recorder didn't show up when I signed on today. That was happening without me signing up for it. And we're asking everybody, do not try to record the meetings, other than if the council's recording it, that's fine. But a lot of people have their own AI recorder. We're asking you not to do that till we get a better policy on it. We have more information. My analogy is like Alexa hearing you say something in your living room, and then you get an ad for it on your computer. So anyway, so on November 15th, there's a NIDA Capitol rally at the War Room in the Capitol building. I know, Brian, you've sent out notices on it. I put the link there somewhere. Must be higher up. So that's in there. It's in person, 11 o'clock at the Capitol building. It's always good to make that room as crowded as possible to get attention. And this is primarily the OPWDD issues for funding. This is going to be a very tough year on the budget. In New York City, it's very tough, where they're asking for a 5% across the board cut on November 1st, and another cut on January 1st, another 5% on April 1st, unless things change. The governor sent out a letter to all the state agencies, asking them to hold their budgets level. So it's going to take a lot of effort this year to go after what we need. And of course, our whole service system needs some major increases in funding. So the first thing I'll mention, just in the education world, on November, where are my dates? On the 7th, and I put that link in here too. State Ed, after many years of not really being willing or able to look at the rate methodology, that's kind of been turned around. They have contracted with a company, and they're having sessions on it. And I put the link, it's near the top of the chat box. So they're going to want to hear about preschools and the school age programs. It's on the 7th and the 15th of November, but that's all on that link there. And they do have a timeline of, which is kind of slow. They're going to, in January of 25, that's a little bit over a year from now, they're going to start presenting the first draft of their finding to State Ed and the work groups. And right now they're planning to start implementing the new rate methodology in 2008-09. That's a long way away. I don't know why it'll take that long, but maybe things will change once they have their hearings. In the early intervention world, and I know there's not that many early intervention providers left, IAC used to have, I think, close to 40 early intervention providers when the program began in 1994. We're down to about 20 or fewer. It's because the reimbursement methodology and providers just can't afford it. There's been no increase since 1994. Last year, we were looking for 11% cost of living adjustment. And the governor's office said, oh, we back it, but the legislature is going to put the money in. The legislature says, oh, we back it. We think the governor's office is going to put the money in. And guess what? Nobody put the money in. The providers, including IAC, have been having some very positive meetings with the State Department of Health Commissioner. He seems to be behind it. He's going to try to get it into the governor's executive budget. So if it, and they're looking for an 11% increase. If it makes it into the executive budget, it usually stays there. The only thing that changes are add-ons. So keep that on your radar. Then a few other highlights from the Provider Association meeting. Nina got most of them all. The Family Support Reimbursement Program, as you know, is a very hot topic because families have not been able to purchase the goods or the services that they've wanted to. It's been a frustration all around the state. And what they said at the Provider Association meeting is that questionnaire is coming out soon. I don't know exactly who it's going to, but we'll keep our ears open. So make sure if you get that questionnaire, you respond to it. On the waiver amendment that was approved, they're going to, I'm just going to give you the important things. I think the most important thing that OPW is looking for, and it helps providers and families, is everyone. When you get a cost of living increase or any type of minimum wage increase in your rates, we'd have to wait for Washington through CMS to amend their waiver and for those rates to go out. Now OPW and State Department of Health have the ability to put it through their regular rate setting system where they post it online, and once it's posted, the money will start flowing. So that's a major improvement. So when agencies get the increase, they can start paying their employees those increase and using the money otherwise. And that's the same with the self-direction fees and rates. That's been a frustration where they self-direction programs see an increase, but it waits for the waiver amendment to come through before that money is available to use. Nina mentioned a new program, the home enabling supports. I guess there'll be some webinars on that. We're looking forward to it. There are some agencies around the state and throughout the country that use assistive technology and remote technology to help support people and their families, and some and in their group homes if it's permitted. So the other announcement out of one of the other announcements out of the Provider Association meeting is some changes to OPW's Quality Assurance Unit or Quality Improvement Unit. They have a new subunit called the Quality Management Technical Assistance Unit. And what this is trying to do is make enforcement of regulations consistent throughout the state. So you constantly hear stories about an audit team in one borough or one county or the other side of the state implement things differently. And rather than trying to deal with it by making phone calls to the regional director, this unit is going to oversee internal controls. They're seeing it as a customer service function. So I haven't been on, I don't know if they've had a webinar yet on that, but they will. We'll try to get them to IAC. And they will take questions from the field in general. So if IAC or another association hears from a provider about something going on, we can go directly to them and they'll try to straighten it out. They also said they're going to be reviewing requests for expansion of services from providers. I don't know if I like that or not, but we'll see what it entails, because in the past it was more in local control what agencies got approval to expand their services. There's been a DAHAB survey regarding how many people are still waiting to get back to their program. We tried to keep that question simple. Our executive director at IAC, Winnie Schiff, spearheaded that survey. She shared it with OPW, but they wanted more questions in it. And we said, well, no, we got to find out exactly how many people are waiting to get back into their day program. So the initial response was slightly over 1,300 people were not able to go back to day program, either because the day program didn't have staffing or there weren't transportation services. We also have a lot of people, as you all know, who are coming out of the Board of Education and need day program placements, But a lot of programs are waiting till they can get their existing people back. And there was a question if there are any change in the COVID protocols now that COVID seems to be knocking on our door again, and a lot of us have not. Well, I haven't had it yet, as far as I know, but a lot of people have come down with COVID. It's not like it was 3 years ago, and there are no new protocols right now. But we'll keep everybody informed, as will OPW and Department of Health. And I think that's it for my report. If there's any questions.
Thanks, Richard. Does anyone have any questions?
I do, Brian.
Rochelle, go ahead.
Yeah. Just thank you, Richard. It's very comprehensive. Just one last thing on your last comment about COVID protocols.
Mhm.
The only thing that we've been talking about in various family forum, especially for our family members who are in congregate settings, is, hoping that and wanting the providers perhaps to encourage and facilitate updated COVID vaccines for people in those programs. And, I haven't really seen much about that. I know there's no mandate. I'm not suggesting a mandate, but I am suggesting that perhaps we should be proactive, because we don't want to see what happened last time in the congregate settings. And I know it's not as bad now, but you never know how quickly, the virus can escalate.
And what I'll do at our various IEC committee meetings is ask what agencies are doing. I know I'm overdue for my vaccine, and I'm in that age range where you're supposed to get an update and supposed to get a flu shot. We'll ask around what's going on. I'll ask our people who staff the clinic committee, and I have the residential committee. We'll see what we can find out. And if anybody on the call now can say what you're doing, I think it's pretty much left up to each agency, but obviously you want to do the best thing.
Thanks. It's an opportune time now because providers are getting flu vaccines for people, and you can do both at the same time. And it would be an easy way to perhaps improve, the COVID vaccination. So I'm just hoping that IAC can help with this.
We'll try to get the official word of the best advice.
And the other thing with the timing, it seems to be readily available, as opposed to when the numbers were much higher in the past. Now you can just walk into a local drugstore. It's just there. You don't necessarily need appointments everywhere. So maybe there are opportunities to have pharmacies come in or do something along those lines. All right. Any other questions for Richard? Richard, I had reposted your 2 links, so they showed up again in the
Okay.
chat.
Great, thanks. And I'll be
All right,
back.
I don't see any. Thank you so much, Rich.
Yep.
All right, next on the agenda, do we have any representatives from New York City DOH MH to give an update? I know that the prior representative was Gavin Myers. He has a new role, and I don't know if anyone else has been assigned.
There have been a couple names bounced around. And I was at a DD council meeting, I think it was in Staten Island on Friday. And there was a representative there, but the report was nothing to report. So hopefully there'll be a change soon. I know that, Brian, if you were part of that council meeting with the city, I heard it was kind of, what do you say? Not everyone was available, so it wasn't very productive.
Yeah. All right, well, we'll keep trying. We'll keep leaving
Yeah.
a slot for them, hoping that someone gets assigned and shows up. It's all we can do.
Yeah.
All right. Marion, you have a question?
No, I don't have a question. I just wanted to mention that I put something from SOS and NYC Fair about calling the governor every day, have as many people call the governor to make our case about DSP wages. Okay, that's it.
And everyone should have gotten that email from the Brooklyn Council email address. So I did, that's one thing we
Yes,
did
you
leave
did.
out. You can call every day, and that's one thing that wasn't in the email. And the other thing is the step 2. So the steps are listed out very, very easy to follow. Please make sure you're doing step 2 because that's the tracking piece, so we can kind of get an idea of how many people are calling. And that's important because, you know, strength in numbers. All right, thank you. And now I would like to present Kelly Weiss. So she is our presenter today, joining us from the New York State Office for the Prevention of Domestic Violence and their new collaboration with the Council on Developmental Disabilities.
Hi,
So thank
everyone.
you for joining us, Kelly.
Hi, Brian. Yeah, thank you so much for having me. I'm going to share my screen. I have a PowerPoint. Can you remind me what time I should make sure I wrap up?
It's 10:45. We go till 12. So I think from when we spoke, you're good. You don't have to rush.
Okay, thank you. I won't need that long, don't worry. So as Brian mentioned, Office for the Prevention of Domestic Violence is working on a project with the Council on Developmental Disabilities. This was formerly known as the Developmental Disabilities Planning Council. They just changed their name. The title of our project is Creating Purposeful Connections, Building Capacity for Gender-Based Violence Survivors with Developmental Disabilities. And I'm going to explain what all of that means and what the project is. Before I do that, I just will tell you a little bit about myself. So my name is Kelly Weiss and my pronouns are she, her, and hers. I am actually very new to Office for the Prevention of Domestic Violence. I just started in March and I came here to work on this project. Prior to this, I worked in the disability services field for the past 20 years. So I come from your world, so to speak. I worked in lots of different roles. I was a job coach. I worked at a site-based day hab. And then most recently, and really for much of my career, I worked at a college program for students with disabilities. And it was in that position that I got very involved with sexuality education and violence prevention programming because there was such a need for it. So we were working with young adults that were navigating the same thing as any other college student. They're away from home for the first time. They're trying to balance responsibilities like school and internship with friendships and romantic relationships and independence. But the difference between the students that we were working with was that many of them did not have the advantage of prior formal or informal education to help prepare them for everything that they were now navigating. So I talk about this almost every single day now, and I can't believe that it is actually true that most students with disabilities are not offered health class or sex education. If they are offered health class, what often happens is that they are physically removed from class during the sex ed portion. So just thinking about that for a second, what message does that send to that student with a disability? And then what message does it send to the rest of the school that this somehow does not apply to you? So as you can imagine, we were seeing a lot of concerning things, and that's why we focused heavily on it. And it was amazing to see the difference in the students once we provided that education. So I became very passionate about it, not just because I think it's so important, but also because I didn't think there was really enough being done to directly address it. And that's what led me to work for Office for the Prevention of Domestic Violence on this project. Before I go any further, I just want to acknowledge that the topic is a challenging one. We're going to be talking about domestic violence and sexual violence. And while these are challenging, can be for anybody, if you have been a victim of gender-based violence, this topic can be potentially re-traumatizing some of the content that I'm going to go through. So please take breaks, do what you need to do, and available to you are these resources up on the screen. There's a New York State Domestic and Sexual Violence Hotline. You can text, call, or chat. It's free, confidential, available 24/7. Feel free to give these resources out to others as well. There's also a crisis text line. This is for any type of emotional crisis. It may not necessarily have anything to do with domestic or sexual violence. Sometimes these types of presentations can just bring up emotions that people want to talk about. So I encourage you to reach out during the presentation or afterward. And again, please share these resources. So as I mentioned, the collaboration is between Office for the Prevention of Domestic Violence and the Council on Developmental Disabilities. What we're looking to do is develop and implement capacity so that we basically want to increase accessibility to services. Because what we have right now is we have very high rates of victimization, which I'm going to go through in a moment. And yet not many of these survivors are accessing domestic violence or sexual violence services. So there is a disconnect, there is a gap, there's barriers in place. We want to figure out what's going on so we can dismantle those barriers, and people that are getting hurt can get the help that they need. We're going to be working across systems with disability providers, with domestic violence providers, and rape crisis programs. The training and resources we develop for each system is going to be a little bit different, but then we're also looking to connect these providers with each other. So before I go any further, I just want to put the project into context and explain a little bit why this project exists, why we are doing this. Just as this image shows an open book with a magnifying glass, you know, that's what we're going to do in like these few minutes we have with each other. And that's what we're hoping the project does, is kind of put the problem of violence against people with disabilities under a spotlight. We're going to move it from the margins into the center and really focus on this issue, because oftentimes it does not get the attention that it deserves. So these statistics are from the Bureau of Justice Statistics, the National Crime Victimization Survey from 2021. The rate of violent victimization against persons with disabilities is almost 4 times the rate for persons without disabilities. So, you know, thinking about that for a second, 4 times. This is for all disabilities in general and all violent crime in general. So we look at that number and we think 4 times is dramatic. This is alarming. But I just want to make the note that it's actually not even accurate, because it doesn't account for unreported cases. Obviously, there's no way for it to. But, you know, while it's very common for there to be unreported cases for any survivor of violence, there are even more unreported cases for survivors with developmental disabilities, because there are additional factors that make it difficult to report. So if somebody has communication challenges, that can make it difficult to report. If somebody is afraid of losing independence if they report, there's just so many different layers. And that's what we're finding to be true as we work on this project, that, you know, the things that are true for any survivor of violence is true for survivors with disabilities, and then some. So there are extra layers of complexity that add, kind of like magnify the situation. So it doesn't account for unreported cases, of which there are many. It also doesn't account for people who live in group homes. And there are over 370,000 people that live in group homes in our country, in this country. So another note just on that is that when we look at risk factors that lead to these very high rates of victimization, people who live in group homes are at much higher risk for being victimized. So the fact that their statistics are not a part of this, combined with the fact that it doesn't account for unreported cases, we have to imagine that this number is actually much higher. And just one more note before I move on. I started doing research on this about 5 years ago, and at that time, the number was 3 times. So someone with a disability was 3 times more likely to be victimized. I think that is a very rapid increase in a very short amount of time. So this problem is not going away. It's not getting any better. It's getting progressively worse, like very quickly. For each racial and ethnic group measured, persons with disabilities had higher victimization rates than persons without disabilities. And women of color and Indigenous women also have very high rates of victimization, as do those who identify in the LGBTQIA+ community. So just thinking for a moment, imagine someone identifies in more than one group that is highly victimized, how that would compound their likelihood of being a victim of crime. Now, these statistics I'm going to give you are specific to people with intellectual or cognitive disabilities and specific to sexual assault. So if we thought the statistics of violence in general were staggering, when it comes to sexual assault, it is even worse. So persons with intellectual disabilities are 7 times more likely to be a victim of sexual assault. And it doesn't account for unreported cases or people living in group homes. And a woman with an intellectual disability is 12 times more likely to be a victim of sexual assault. I mean, these numbers are really hard to comprehend, to think about someone being 12 times more likely to be a victim of sexual assault. And these are the people that are speaking up, and a lot of people are not speaking up. And only 13% of victims with disabilities receive domestic and/or sexual violence services. So this is where the project comes in. We clearly have a very serious problem, so I want to show you what our plan is for the project and opportunities that you all have to collaborate on these early stages. So I welcome you at any point to unmute yourself or put something in the chat if you have a question or suggestion at all. So basically where we started was we identified stakeholder groups. So disability service providers was one group, domestic violence and rape crisis programs, people with disabilities, self-advocates, parents, and family. These were our main stakeholder groups. As we're doing these kind of outreach sessions with different groups, we're learning there are many more stakeholder groups that we need to interact with. So there's medical professionals, there's law enforcement, there's the court systems. So there's long-term plans to interact with more stakeholder groups. But for now, because we are, I mean, quite frankly, in a reactive moment, we are an emergency situation. So right now, our focus is the providers. We need to make sure that people that are getting hurt are getting the help that they need. And then we will shift focus to some other areas that the project wants to work on. So what we did was we identified those groups, and then we said, okay, what we're going to do is we're going to develop training and resources and technical assistance for all providers. But before we do that, we really want to talk with these groups and find out what is it that they're seeing, what do they need, what will be helpful in a training. So we developed these learning exchanges. These are listening sessions. And what I'm doing is I'm going all around New York State and I'm talking to all these different stakeholder groups, virtual and in person. And we're basically trying to get as much information as we can. So for disability providers, we're very curious about knowledge and comfort with topics like domestic violence, sexual violence, knowledge of community resources they can refer the people they support to. We're also curious about the risk factors that lead to the very high rates of victimization because, all right, so it's a fact, this is a very serious problem. We're interested in that, of course, but we are very interested in why is that a fact. So we want to decrease these rates of victimization, and we need to know what are the risk factors that lead to the very high rates. So we're asking disability providers about that. We're also curious about barriers that are in place. Why is it so difficult for someone with a disability to access these services? When we meet with domestic violence and rape crisis programs, we are very curious about knowledge and comfort around developmental disabilities, around reasonable accommodations, and also risk factors and barriers. When we meet with self-advocates, people with disabilities, we're very curious about access to education, about why people don't report, and community barriers that they've experienced. And then parent and family is kind of similar to the disability provider learning exchange and the self-advocate learning exchange. So that's at the stage we're at now. We've already hosted quite a few. We've already learned a lot, but we're looking to do more. So that's where all of you potentially come in. If you're interested in hosting a learning exchange, I can come in person or I can do virtually just like this. And we're really looking to just tap into people's experience, their expertise. Like we want to develop trainings that are going to be useful to people. So we want to find out what do people need. And we also want to spread awareness of this project. That's another objective of the learning exchange. So once we host all the learning exchanges, we're going to collect all the data, we're going to synthesize it, and then we're going to look for themes that emerge across the board. Already, even though I haven't done any formal analysis, just having done all of the learning exchanges, I can tell you there are significant themes that are already emerging. So then we'll develop recommendations and we'll start with one initial training, getting providers together with the idea that there will be comprehensive ongoing opportunities for training and resources. Once we feel that providers are equipped, because I guess we're hearing about different needs from different sets of systems, as you can imagine. Once we have people trained and set up where they feel confident in doing this work, then we really need to shift our focus to preventative work. Our goal is that every person with a disability who receives services in New York State has access to sexuality education and violence prevention programming, because it is absolutely essential that we have to empower the people that we support. We can't stop at just training providers for lots of reasons, but one reason is that there's very high rates of perpetrators being tied to the person through their disability. So staff members abusing the people that they support. So that's going to be our focus. And then we really need to identify long-term sustainable solutions, because this grant we're working on is a pilot project. So once the grant is up, we need to find other ways to continue this work, because there's no way the work ends in 2 years. There's just so much that needs to be done. So that is where we started, where we are now, and where we're going. Are there any questions? Any suggestions?
I have a question.
Sure.
So I know you've talked about meeting with self-advocates and agencies and professionals and other stakeholders, but what about families?
Right. So that's one of our groups, is parents/family members. So we've actually attempted a few learning exchanges and no one has signed up. I do have one coming up in November that's virtual. So far, I have one person registered. I also have 3 coming up back to back in Albany in person at the end of November, and we're getting more interest kind of in that. So that's another, I'm glad that you brought that up, Brian, because that's another group that I encourage. If you have opportunities for me to speak with more family and parents, I really welcome it, because I haven't had as much as I'd like to really inform this project. It's such a vital perspective.
Hi.
Hi.
I want to make a comment. I'm Suzanne McDermott. I'm new to the DD Council here. I'm a professor over at CUNY School of Public Health in Harlem. And I'm going to make an announcement at the end of the meeting about a research project we're working on. But this dovetails exactly with what we're doing. We're doing a sexuality and socialization program. And we have a whole protocol for abuse and neglect reporting, because our health educators are going to be working one-on-one with people with IDD across the state. And so I think it'd be best if I emailed you separately and we could have an actual conversation. I don't think we have to talk about it here, but clearly we're all about the prevention, but we're also all about the reporting and the knowing. So it'd be great if you and I could talk.
Absolutely. I would love that. I welcome that. Reach out to me, email after this call for any opportunities just to meet, talk further. If you see overlap in your work or you just want to, talk more about it. So yeah, I encourage that.
Okay, perfect.
Yeah.
I just want to add, I think this is a great group for you to come to, and I was glad that we were introduced and connected, because there are a lot of families on this call and families with access to parent groups. So I think that could be good for you to make some connections with some families on this call to help build that interest and that, not interest, but the participation.
Yeah, wonderful. That's good to hear. Thank you. And Rochelle, you have your hand up.
Yes, I was just wondering also if you have reached out to the CCOs.
Yes,
Because-
Yes, thank you for mentioning that. I always forget about the CCOs because it was kind of rather later in my outreach. So yes, I have. In fact, I was just up in Rochester last week at Care Connection Day. There's a big CCO organization called Person Centered Services that hosts its big day. So I was able to connect with 200 care coordinators. And then on Wednesday, I have a care coordinator learning exchange and then a webinar. So yeah, I've gotten involved with a few different care coordinator organizations because I think that's also an important perspective and they are a main point of referral. So yes, thank you for mentioning that. I forgot to say that.
Right, and all the CCOs also have member and family advisory boards.
Yeah.
And meetings where, this issue could be discussed as well.
Yeah, that's true. I should specifically ask about that because it is a group I'm looking to talk with more. I'm going to be at the Sandy's conference on Friday, so I'm excited about that. That's going to be another self-advocate learning exchange. And I'll be tabling all day. If anybody's going to be there, stop by. And then I think I saw another hand up. Oh, Wayne?
Yeah, hi Kelly. I put our information in the chat for you to do a presentation at my timing. Could you hear it?
I'm sorry, could you say that again? I was having a hard time understanding.
I put our information in the chat for you to have a presentation at my timing.
Oh, great. Okay, thank you so much. I'll make sure I check that before I log off. I appreciate
Yeah,
it.
Wayne is from My Time Inc. That's what he was saying. So he left information in the chat to connect with him.
Okay, great. Thank you, Wayne.
Okay.
And I think I saw another hand up earlier.
You might have seen mine. I took it down. I would like to connect with you, Kelly. And also, I'm going to tell you as a parent, some of the numbers you were saying and facts are sometimes hard for a parent to swallow. So on that note, maybe we can continue I can have a big outreach for families in New York. But maybe we can talk privately also. I'll put my number in the chat.
Okay, thank you, Mary. I would really like that. And I also welcome, like, I'm very happy to customize these sessions for different audiences. So if you have suggestions, when we talk off this call of how maybe it can be a little bit more, make things a little bit more receptive, a little, I would welcome that. Any kind of suggestions, we can modify the learning exchange also.
Right. I mean, it's you can't sugarcoat numbers, and it's a fact that a parent faces. It's a parent's worst nightmare. So that being said, I look forward to chatting with you. Thank you.
Thank you. I look forward to it also. I appreciate the opportunity. So I'll go through and just show you basically how the learning exchange is outlined, just give you a little bit of more information about the content. So for disability providers, and again, I welcome opportunities to talk with parent family groups, to talk with disability provider agencies, different staff, I've done all different things. I've kind of met with just the clinical team. I've met with leadership. I've met across the board from DSP to the CEO. So anything that works for your organization is fine with me. But basically we start off, I give kind of the intro that I gave to all of you. And then we ask questions about these terms. Like I put them up on a whiteboard, or in person, we put it up on a big board, and we say, like, what comes to mind when you see these terms: domestic violence, sexual violence, and consent. And then we have a conversation about, what do you think the people you support know about these topics? And that can be really tough because, one, you're asking generally, what everybody's knowledge is. But when I think about my own experience, I think that I probably could say for each program I worked at, generally speaking, what I felt people knew. And what I'm getting from past learning exchanges is that they don't feel generally the people that they support know a lot about these topics. So then we start talking about the risk factors. I kind of open it up and I put people in groups and I ask people to come up with, why are people with disabilities, why are they so much more likely to be victimized? What are the reasons? And then they all come, and then we come back together as a big group, people share, and then I kind of fill in the blanks. So any risk factors that people didn't identify, I offer, and then we discuss. And then I do the same thing with barriers, put people into small groups. What do you think are some potential barriers? A lot of times people think physical barriers first, which are significant and are certainly a barrier to accessing services, not having like a ramp up to the building for someone who uses a wheelchair, things like that. But then people don't often think of some other barriers that are in place, communication barriers, policies, training, things like that. So I put people into groups, they could discuss barriers, and we come back together as a large group, and I do the same kind of thing as I did with the risk factors. Any questions on how the learning exchange is laid out, the format? But again, I do customize things for different groups. I mean, Mary, you made the good point. You can't, the reality of this is that it is awful. There's just no two ways about that. But I certainly can incorporate different information, or, I can tailor things to different groups, and that is inclusive of disability providers. So keep that in mind also, if you feel for whatever reason this might not fit your group's needs. We also send out an anonymous survey, and I can send that to Brian to go out to this council. The anonymous survey is for any disability provider. It's just another way for us to gather data. I also have a parent and family survey too. So we want to give opportunities for people to give us information through small group discussion, large group, chat box, whiteboard, but then also the anonymous is really nice because we're getting a lot of transparency where we don't think necessarily people would be quite as honest if they were, their name and agency was attached to the response. So there's lots of different ways to participate. So any questions about the project or the learning exchange?
I would also ask Kelly, have you tried to connect with the Justice Center?
Yes, so they have, yes, they've been great. They've actually joined in on quite a few learning exchanges. So they're very interested in this project. We think it's absolutely essential to collaborate with them for lots of different reasons. So yes, they are on board. And so as the project continues to develop, we'll continue to kind of involve them. OPWDD is also very much in support of the project. They're aware of it. They're probably going to be sending out a letter to providers to encourage participation in the trainings once they get developed. Because that's another important partner for us. All right, well, I just end kind of on, I try to end somewhat on a positive note because everything else that I say is pretty awful. That, you know, we really believe that although gender-based violence affects all of us in particular, and especially people with disabilities, we really do believe that with education and action, we can end it. You know, this might seem sort of ambitious to say, oh, we're going to end this type of violence and domestic and sexual violence. But I don't think it is, because I think if you like that is your goal, then you get as close as you possibly could get to that goal. And if you lower your standards, who knows how much you could have accomplished. So that's our goal. And I think that's great. So I guess for this call today, you know, thank you for your time. I'm very appreciative of it. I know you all have a lot of important work to do, but I encourage you to talk about this project with others, to get involved, contact me for opportunities to talk with other groups. And here's here's the resources again that are available to you that you could reach out to. And then this is my contact information, my email and my phone number. And I'll make sure I look at the chat for the numbers that folks shared with me. So thank you again. I really appreciate your time. Are there any last questions or thoughts?
So just so everyone knows that the meeting is being recorded, it will be posted on our website. Kelly did share with me the PowerPoint. I believe it's okay if I share it out, right, Kelly?
Yeah,
Yeah,
absolutely.
so that way anyone that missed contact information or some of the resources, you can see it on the video, but I will also send out the PowerPoint directly via email for anyone, to everyone.
Great, thank you so much.
Thank you so much, Kelly. All right. So next up on our agenda, I believe, are committee reports. So I know that Debbie made one earlier for her provider, family, and care management information. I believe we have Marjorie, and I think I saw Pilar, if you guys want to jump in.
Sure. Good morning, everyone. Name's Marjorie Antoine. Our Children's Services Committee is just starting off, so not much to report, only that we're excited to get the committee up and running again. Our next meeting is going to be held on Wednesday, this Wednesday at 9:30 a.m. And we encourage everyone to please join us so that we can continue to do good work and provide vital information to our families. Thank you.
Hi, good morning, everybody. My name is Pilar Jones, and I'm the co-chair of the Transition Committee. My other co-chair, she can't join us today, I think, but I just wanted to report a little bit on our last meeting. We discussed who is a part of the transition services and what those roles might be for those particular people, specifically transition coordinators at schools, care managers, and then a provider's role as somebody who's transitioning to their service. I think we learned that participation in our committee is something that we are struggling with. So if you do have a colleague that's involved in transition services, please encourage them, because we're trying to, I think, mend the connections between care management and providers, and parents and families as well, just so that some of these questions that they have may be answered. Our meeting for November, we decided we're going to change the date from our typical third Thursday. I think that's one, because of Thanksgiving, and two, because the P77 is having a transition fair at their school. So we want to make sure that some people that would typically attend our meeting can go to that fair. So the committee meeting will be for the 30th next month in November instead. I updated the invite. So those of you that are already on the invite, you should have received an update. I'm also going to be sending out just like a little summary from our meeting last week. So I'll remind everyone there that the meeting has been changed to the 30th. That's it.
What time?
Same time, 10 to 12.
And if you're not on Pilar's mailing list, you can contact her or me, and I will make sure it gets to her. And remember, if you go to our website, bkddcouncil.org, I try to put all of the committee meetings up there with the links. And then we also have a sticky post for all upcoming meetings and dates aside from going to our calendar. So you can find any upcoming meetings right there as soon as you get onto our website.
Do you have OPWDD transition coordinators as part of that meeting? Do you guys know?
So we would like to have some for sure. I think we are a little bit not sure of who exactly we should be getting the information to. So I know that Heather recently had a conversation, I think with Patricia Webb, about this. So I'm not exactly sure. She's not here today, but I can double check with her. But I know we were trying to get some attendance from that as well. So I'm gonna put some information in the chat. If you could pass that along, that'd be great.
Absolutely. So I know that for a while there, so each borough has a transition coordinator. Unfortunately, you know, for a while we've struggled in Brooklyn to fill the position. So we currently have somebody on, you know, in place. They're still transitioning. But Patricia is the supervisor, so if she's aware of it, I can also pass the information on. But just make sure that, you know, you have a representation from us.
Okay, great. Thank you.
Sure.
I put
Thank
some
you so much, Lucy.
information well in the chat about the transition committee. We have an email address. You can send us an email if you have any questions. We also utilize a Google Drive where we put old flyers and information, old presentations that people have given, so you can access it as long as you have access to the drive and have the link. So if you have any questions, feel free to contact me or Heather at the Brooklyn Transition email address.
All right, thank you for your updates. And like I mentioned at the beginning of the meeting, Rochelle and I and the rest of the team are in the process of trying to start up the employment committee. And we have some interested candidates that will hopefully be starting that and chairing that soon. And we've also been reaching out and trying to start back up our legislative committee, which obviously is of utmost importance to all of the councils and everything that we do working in this field, or being a family member and a parent in this field. All right, just before we get to general announcements, next month, the Brooklyn Council meeting is scheduled after Thanksgiving, that Monday on the 27th. Please make sure to mark it down and attend, as we will have a special presentation by Kim Hill, who is New York State's first Chief Disability Officer appointed by the governor. And she will be coming to do a presentation on employment for people in our population. And then I can also say for December, just to throw it out there, our meeting is the week before Christmas. So it's on the 18th. And we will be having a presentation by Suzanne McDermott, who just spoke before. And I believe we'll be doing a quick announcement coming up on the project she's working on at her CUNY school. All right, so now I can open up the floor to announcements. Again, please also, if you're going to make an announcement, also put it in the chat. That is helpful for a lot of families and agencies, but you can raise your hand. And Ezra Payne.
Sorry, it's actually Zadian Richardson. I thought I changed it. Yes, I'm with, my name is Zadian Richardson. I work with the Brooklyn Public Library Inclusive Services. Good morning, everybody. And I did place in the chat our upcoming meetings that we have coming up for November. And was everybody able to see what I placed in the chat? If not, I can briefly just give a synopsis of what I placed in the chat.
I saw it, but I would say just give a brief synopsis because it does go by quickly.
No problem. So on Friday, November 3rd, from 11 a.m. till 1 p.m. at the Canarsie Library, the address is 1580 Rockaway Parkway, and it's at Avenue J. We're having a presentation by the Brooklyn Family Support Services Advisory Council. And what that is about is for families to find out more about Brooklyn Family Support Services Advisory Council, Office of People with Developmental Disability, MTA Reduced Fare, My Time Inc., and local services provided, and more. If anyone has any questions and they would like to find out more about what would happen at this meeting, you can email, you can actually call 718-264-5855. 5084, and that is the information for the Brooklyn Family Support Services Advisory Council, or you can reach out to Kerry Banks, and her number is 917-751-4980. The next item that I placed was supporting grieving children, and that is going to be a virtual program, and that's going to be Thursday, November 30th from 4 p.m. until 5 p.m. And there will be Spanish interpretation should anyone need it. And basically, this is about supporting a grieving child. Is one of the most difficult things we do as parents, as adults in our lives. And basically, it's to talk, it's a panel discussion on how youth basically experience grief and how we can talk to them about death and listen to them and basically listen to them. They're going to be, they're going to learn about books and different conversation and resources in the community of how to help them support grief. The last information that I placed in the chat was navigating your child disability one-to-one, and that's going to be on Wednesday, December the 6th. It's a phone-in meeting, and that's going to happen from 10 a.m. to 1 p.m. And that is with Include NYC, and the person that takes care of it is Ruth DeRoma, who I'm sure everybody knows, and basically is just making sure that whatever situation you have, whether it's the IEP process, getting services for your child, early childhood services and program, transitioning program, community resources, or referrals that are needed, that at this meeting, phone-in meeting, you'll be able to speak to somebody one-to-one about it. Thank you, Brian.
Thank you so much.
You're very welcome.
All right, next up we have Suzanne.
Hi, I'm a parent of an adult with IDD, so I'm most of my life I've been part of a DD council. I have only been in the city now. I grew up here, but I'm back for the past 3 or 4 years. So I'm a professor over at Cooney School of Public Health, and we're starting a brand new program about health education, and it completely overlaps with the discussion about sexual violence and consent. We're providing this for people 16 to 27 years of age, and it's funded by the National Institutes of Health out of Washington, a really highly thought of program, and it's available to anyone in New York State, any place. It's 6 weeks, it's remote, and it's really special. It's really wonderful. So if those of you who know of people or have family members, we're looking to enroll people right now. This is our first month of enrollment. We're going to be enrolling for the next year. So there, if people don't get on now, they can get on later. But we have lots of information, wonderful health educators. It's just a 1 day a week, 1 hour. The person is remotely on the computer with our health educators. And we've tried it in another state. It was exceedingly effective. We cover all the important issues, and we really want people in New York to join. So thank you.
Thank you, Suzanne. And again, Suzanne will be back for a full presentation with us in December with more details about the program. All right, next, Michael.
Hi, thank you. Can you guys hear me?
Yes.
Okay. Good morning. Thank you for giving me the floor for a little bit. My name is Michael Guino. I'm the transition coordinator for P77K. First off, I want to thank Pilar for making that adjustment with the council meeting on her end. So thank you for making that for us. I just wanted to speak today very briefly to say that 77 is hosting our annual transition fair on November 16th from 9 to 12. We're located at 62 Park Place, so we are down the block from the Barclays Center in Brooklyn. Very easy to get to. This is a bigger event than what we wanted. I don't say we wanted to, but then we were really anticipating. It's really growing. So we wanted to extend the invite to a lot of the providers that are here and everyone here. If you wanted to partner up, have a table, there's no table thing. I know that was a question that was asked. if you are a parent or someone who just wants to attend to get the information. We have about 25 providers, I believe, right now who are going to attend. So we do hope that it will be a really nice event for our families and for the families, in Brooklyn and within the city. I'm attaching the flyer and the letter from the school from us in the chat right now. If you wanted to join us, you could just RSVP. If you had questions, shoot me an email. But again, thank you for letting me speak to that. So.
Thank you, Michael. And again, after the meeting, I will forward out to the whole mailing list, the flyer and the information again.
Thank you so much, Brian.
You're welcome. Next up, we have Jay.
Hi, good morning, everyone. Jay Kleinman from LifeSpire. Two announcements. Wearing two different hats today. So one is that LifeSpire has crisis intervention in Brooklyn. So we offer case management, information, referral, linkage, that type of stuff. And the information's in the chat. You can either email me or call me. And then changing hats now. The Queens Family Support Fair is this Friday at the Flushing Sheraton. And we have about 60 agencies that are going to be tabling there. So it's a great one-stop shop to get a ton of information on resources and openings and services and all of that stuff. And I put the link is in the chat for that as well. Okay, thanks a lot.
And Jay, just a reminder, families are free to attend that. It's
Oh,
only the
absolutely.
agencies that are
Yeah,
required,
so
just
families, it's
throwing it out there.
completely free for families and professionals. In fact, the only fees are for agencies that want to table. Yep.
Thank you, Jay. Next up, we have Paula.
Good morning, everyone. This is Paula Martinez-Moon from the New York Lawyers for the Public Interest. Just reminding everyone that New York Lawyers provides free legal services. We are a nonprofit organization, almost 40 years representing people with disabilities, immigrants, and other populations in disadvantage. We also, I also want to remind people that besides taking individual cases and class action cases, we also do a lot of trainings, and those are all for free. Know your rights trainings regarding special education, know your rights trainings about housing, training about in general what we do as an agency, very popular future planning trainings that includes supplemental needs trust information, special needs trust, supported decision making, power of attorney, guardianship. So, and all those are available to you for free. So if you want to book any of those trainings, you can, contact me directly. And if it's me who's doing the training, obviously we can coordinate dates. But if it's somebody in the area that you're looking for, I'd be more than happy to connect you to that individual internally. I did put my information, New York Lawyers information in the chat. But, if you Google us, if you forget and you don't grab it for them, New York Lawyers for the Public Interest, you will end up with our main number. I also, lastly, want to do a plug for the Queens Fair. It's important to share that information to families. It's going to be a lot of us there providing information for families. So please spread the word. Thank you so much.
Thank you, Paula. Next up is Wayne.
Yeah. Hi, everyone. Wayne from My Time Inc. Wayne Clark from My Time Inc. As part of our Me Time program, we are hosting on November 3rd, we're hosting a comedy show. And we'd like to invite some parents. You could RSVP at Wayne at My Time Inc. And also I will put the information in the chat as well. Thank you.
Thank you, Wayne. All right. Jay, is your hand back up or is that from before? And I think that's from before. Does anyone else have any other announcements? Are there any elected officials or representatives that have any announcements or want to say anything to the group?
Brian, this is Sandy from Adapt Community Network.
All right, we can hear you, Sandy. Go ahead.
Okay. I just wanted to let you know there's some exciting free webinars that Adapt Community Network is having. The first one is Intro to Preschool Special Education. It's going to be this Thursday, October 26th, from 10 a.m. to 11:30 a.m. And the next one is going to be Intro to Access VR, what it is, how to apply, and what to expect. That's on Thursday, November 2nd, 10 a.m. to 11:30 a.m. And the last one is Benefits and Entitlements Transition Planning on Thursday, November 9th, 10 a.m. to 11:30 a.m. All of our webinars are free. We always provide Spanish and Mandarin translation. And to register, email Family Connect at adaptcommunitynetwork.org. Unfortunately, I couldn't get on the meeting with the link, so I can't put it in the chat. So if you have any questions, please email Family Connect at adaptcommunitynetwork.org. Thanks a lot and have a great day, everyone.
Thank you, Sandy. And I believe all of Sandy's flyers have been emailed out by me over the last week, so you guys should have them, and I'm sure I can email them out again. Next,
Thank you,
Angelica.
Fabian.
Hi, I'm Angelica James with Unique Care Community Services. So we have a couple openings in our program, our Brooklyn programs. They have breast in our afternoon program. So I add my information into the chat. You need to bring out
Okay, thank you. All right, any other announcements?
Hi, Brian. I do not have another announcement, but something triggered my memory when you said that you sent out information to all of us. I am not receiving any emails from the council at all. So perhaps maybe my name is no longer there. I don't know, but I would love to receive the information because I very, very big in sending out stuff to the families. So if you can add
All right,
me.
I will double check and make sure you're on our mailing list. Maybe something got lost when I took it over from Chris.
Oh, got it.
So I will check and make sure that you're in there.
Okay, thank you, Brian.
You're
I
welcome.
appreciate that.
No problem. All right. Anything else from anyone? Any of the officers on the council? No? So you guys get a half hour back in your day.
Wow.
Thank you.
Thank you, everyone. Have a great day. Have a great week.